And now to a warning from the White House that another COVID-19 wave is possible as holiday celebrations are underway. Take a look at this. The past 3 weeks of COVID numbers in Michigan spiking from nearly 9,000 new cases on November 29th to 13,000 new cases reported this past Tuesday. Our chief health editor, Dr. Partha Nandi, joins us now. And Dr. Nandi, are we headed toward another winter surge?
Yeah, it seems a little scary, right? Our COVID numbers, Glenda, are heading in the wrong direction, and we're seeing more virus levels in wastewater, which is often an early indicator when it comes to future surges. Now, how bad will this winter be? That we can't predict. On the plus side, we have widespread vaccination and previous infection, which means we have a decent wall when it comes to immunity. And even if cases do surge, it appears that fewer folks will develop severe illness. Still, there are many factors at play. We have new dominant variants, Omicron's BQ1 and BQ11, and none of the monoclonal antibodies work against them. This could really affect folks who are immunocompromised. Also, we have low booster rates, which means that widespread immunity I just mentioned is fading.
So we know the first vaccines went into arms 2 years ago now. So have they worked, and why are we still seeing cases like this?
That's a big question, right? Yeah. It's absolutely, I would say unequivocally, that they have worked. Around 658 million COVID vaccine doses have been administered over the last 2 years, and those shots prevented an estimated 18.5 million hospitalizations and 3.2 million deaths. That's according to a new report from the Commonwealth Fund and Yale School of Public Health. Also, according to CDC data that looked at the week of September 25th, vaccinated and boosted people aged 12 and older had a 15 times lower risk of dying. That's a lot from COVID compared to people who were unvaccinated. So the big question is, people saying, why are we still seeing thousands of cases? It's because vaccines are not 100% effective at stopping infection. The goal was to stop severe illness and prevent deaths, which they do. Another reason is the waning or decreasing immunity combined with the newer variants. So once again, I will stress the importance, right? The importance of vaccines and getting boosted. If you get vaccinated now, you will have a decent chance, decent protection by Christmas and New Year's, with many families and friends gathering together to celebrate. And I would also say get the bivalent, right? Lots of people, like less than 1 in 5 folks have gotten the bivalent vaccine. That's what you need to do.
And do you ask for that? Like you
do,
ask for it?
You ask for it, and they'll have it.
All right. Dr. Nandi, thank you always.
Oh, my pleasure.
Okay. And if you have a question for the good doctor, you can email him at drnandi at askdrnandi.com. But there's an all-new episode of the Dr. Nandi Show this weekend. This week, the doctor explores the cultivation of happiness. You can watch it at an earlier time Monday morning at 1:30 a.m.